Once again, we get to have the pleasure of talking to one of the experts, ENT, Dr. Suzanne Cleland-Zamudio. Did we get it close?
Yeah, that's pretty good.
Pretty good. All right. You are a special breed of cat, I got a feeling, from what we've been talking about here in terms of what you do and how you do it. Normally you think of, head, eye, ear, nose, whatever, and, I got the sniffles or I got a sore throat. Or you are a surgeon and you do the big weird stuff, don't you?
Yeah, I do.
Yeah. Tell us a little bit about the kind of things that people in Central Washington could get addressed by visiting you down in Sunnyside.
Sure. So I'm academically trained, and I was in private practice in Portland for 25 years, and I was called up by Sunnyside because a lot of ENTs in the area do tubes and tonsils and very simple ear, nose, and throat things.
Right.
But there was definitely a need for more advanced procedures, such as reconstructive plastics, head and neck cancer, facial trauma. I'm trained in level 1 facial trauma.
Wow.
I'm the only one in the valley trained in that.
That's why I say get the bubble wrap. We want to preserve it.
I do skull base, advanced sinus, and ear surgery. And I do tubes and tonsils, too. It's just I am trained in more advanced techniques and advanced procedures.
Well, again, I imagine they are not just falling off the truck. So to have someone with this kind of background providing services in Central Washington is a pretty big deal, and we're glad that you're here, and we're glad you're going to spend a few minutes telling us a little bit more about, first of all, you left Portland, wise decision number one in our playbook, but you're here to see patients. And are there certain kinds of things that would come that you would see because you're in an agriculture area, or if there's been accidents, trauma, whatever? Is it different to treat people here than, say, in an urban setting? Is there any difference in terms of the types and the number of conditions that require your expertise?
I'd have to say that the main thing I've noticed is I also have a master's degree in sleep apnea. And I've noticed that there's a huge need for identification and proper assessment of sleep apnea patients in this valley. And so I've done a lot of that working with Sarah McDonald from Astria. She's our sleep medicine specialist, and we have our own sleep study at Astria and Sunnyside.
I should come and sleep with you guys. What I mean by that is have a study. That's what I meant. Yeah. I'm a sleep apnea patient myself.
Oh, wow.
And have been for years and years and years. And I will sit here and attest to the effectiveness of sleep apnea being addressed with whatever procedure and technology that you guys say. It is life-altering and must do. So if you are, if they're constantly fatigued and snoring and all the other things that jump-starting your body how many times during the course of the night, I mean, it is really tough on a person, isn't it?
Yeah, and it's amazing also how serious it can be if it's not treated. We're seeing patients that are already in heart failure at 35 years old because they don't treat their sleep apnea, and that's
crazy.
Just heartbreaking. So being able to identify it and make sure they understand the seriousness of treating it, and how, a CPAP machine's not that bad. You just got to give it some time.
Tell you what, if I've had people say to me, "How do you sleep with that thing on?" I go, "Dude, I do not sleep without it on. I just don't. You don't get into that REM sleep and the healing and all of that." Now, cancer. Oh, my gosh. I know that that's something that you deal with, head and neck cancers. It does sound scary. And how common is that, and what can you do when that happens to be the case of the patients who come see you?
Well, we're seeing more cancers that are not related to smoking, which is concerning. They're related to HPV, and they're mainly oral cavity and tongue cancers. So just being able to make sure our dentists in the area are educated about what does cancer look like in the mouth and how they can get it to us quickly. I know when I first came to the valley, I was brought here for patient access, so patients had access to the kind of things I do.
Right.
And so one of the things I do is I don't require a referral.
You don't?
No, because it took a cancer patient 3 months to get a referral to see me.
You don't have that kind of time.
And your cancer is from stage 2 to stage 4. That's crazy. So the only insurance in the valley that requires a referral is Kaiser, so they have to get a referral. But if patients just call, they can make an appointment, and I can get records from their primary issue.
Bless you, my dear. Bless you. Look, that's huge. We had a friend in the radio business who got cancer of the tongue, and that ultimately took him out. So we went to fundraisers for him and know the seriousness of that. And, it's just, I can't even, I don't want to go into it. It's too weird. But
we're very fortunate to have an oncology center of our own with Dr. Inklab in Sunnyside. And we work with fantastic colleagues with Northwest Cancer Center, Dr. Cho, fantastic radiation oncology. And so we just have a really good team to take care of those people.
Well, that's one of the things that people might say is, well, if I go to the bigger city, they'll be able to handle all the things that I can't get handled, maybe locally. But what I hear you say is that you've got a team and you can handle just about anything from a cancer perspective that people would want to know or need to deal with if it affects the eyes, ears, nose, throat,
head.
That's
why Sunnyside brought me here.
Yeah, well played, Sunnyside. Jane's over there going, thumbs up, baby. Yeah. So do we see, my wife has sinus issues, and has had them for years and years and years. And I don't know. I don't want to be into the boring world because we talked about this. But what is it about? What can you do for the average person who seems to always be getting sinus headaches? Is there surgical adjustments for that, or is it just live with it, take this medication? So what goes on behind the eyes and the nose of people that always seem to be in sinus issues?
There's been a lot of studies done about people who have facial pain, because in the olden days, remember the 80s commercials, everybody's got sinus and holding their cheekbones, and they actually studied that, and they discovered that over 90% of people who had, quote, sinus headache, their CTs were normal. They didn't have a sinus headache. Their sinuses were normal. They discovered that was more likely either a facial pain from grinding their teeth at night, a facial pain and ear pain, with ringing in the ears too, or people who had inflammation in their nose from the irritants they're breathing in, like hops is a big one. When they harvest hops around here in September, everybody comes in feeling like their face is going to explode, and their CAT scans are normal. It's nose inflammation. But that's what nasal steroid sprays were invented for. They're not really allergy medicine. They're not an antihistamine. They treat the inflammatory response from things we breathe in that can make our face hurt.
Gotcha.
And so it's just important to have it assessed, like get a CT. Is it really your sinuses or is it not? And then find out what it is so you can treat it properly.
Knowledge is power, right? So get in and see it, and then you can prescribe what the path is to get rid of it.
Yeah, tell your wife to come on down.
I should. I've been told that my mere presence makes a lot of people's face hurt, so I don't know about that. I have to watch out for that, Suzanne. But hey, we are speaking with the delightful ENT, Dr. Suzanne Cleland-Zamudio. She's the ENT and kind of a one-of-a-kind expert for our region down at Astria. This is fascinating to me. I could chat with you all day about various ailments and situations. But as we've learned, no referral, fabulous. Call and make an appointment. An approach that says, we're not just going to slap a Band-Aid on your nose. We're going to take a in-depth look at what's going on with you, so we recommend the right treatment. And there are times when surgery is going to be called for, and we're set up to do that at Sunnyside, get you done?
Absolutely. And we've been told there is a huge need for my services in Yakima. I've got people who drive all the way from Ellensburg to Sunnyside to see me, and it makes me feel badly. So as of July, I'm also going to be in Yakima.
I was going to say, let's meet for lunch. I can make you an offer you can't refuse. Maybe we can steal you up to Yakima, but you're coming voluntarily.
Yeah, in July.
So there, I get to save myself buying lunch. How about that?
We'll be in the Creekside area.
Okay, great. Well, what do you want folks to take away from this? As we wrap up our time, Doctor, when it comes to ENT stuff and the fact that you have an education and a skill set that probably we haven't seen, what's the takeaway for folks and on behalf of yourself and Astria?
Well, I think that the big message is that Sunnyside, Astria has made a huge effort to bring world-class specialists to this region. And not just me. I did train in the top 10 program in the country, but so did our endocrinologists. And so did our interventional radiologists from Johns Hopkins. I mean, we have incredible specialists at Sunnyside, and I think it's a well-kept secret that people need to know about.
I think that, putting it mildly, I agree with you 100%. I joked about, Tony Bennett said he left his heart in San Francisco, and I left my gallbladder at Astria. So I get some mileage out of that joke, but it's true. And people need to know, as I said before, the folks that you deal with when you're dealing with Astria are the most, patient, understanding, willing to explain. My experiences there and my wife's have been just fantastic, and I can see that we have another one in you. Now, you've been here a little while, but now more and more folks are going to know about you, and I hope your phone is ringing off the hook all the time, and we're really addressing some of the needs that really need to be dealt with. And by all means, whatever she tells you about sleep apnea, double down on it. Do it twice. Doctor, great to meet you. Thanks for your time this morning. Really appreciate it.
Pleasure.
Yakima, this is, again, one of the great things that we get to do is to talk to these experts out of Astria with our host calls, and we appreciate it very much, and we hope you enjoy and learn.